Dr. Asma.
Sir, am I audible? Okay. Sir, just a second, sir.
Okay.
Dr. Asma. Is that my voice audible?
So just a minute.
Am I audible?
We are just checking our audio, sir. Yes, you are audible, sir. You are audible.
Hello. Hello, Asma. Nandu voice ಕೇಳಿಸ್ತಾ ಇದೆ? I am audible.
ನಿಮ್ದು audible ಇದೆ. So ನಮ್ದು ಸ್ಪೀಕರ್ ಸ್ವಲ್ಪ ಪ್ರಾಬ್ಲಮ್ ಆಗಿದೆ.
Okay.
ಸೊ ಕ್ಲಾಸ್ ರೂಮ್ ನಲ್ಲಿ ಸ್ಟೂಡೆಂಟ್ಸ್ ಎಲ್ಲ ಇದ್ದಾರೆ, ಅಲ್ಲೇ ಲೈವ್ ಇದೆ.
Okay. ಅದೇ ನಿಮ್ದು ವಾಯ್ಸ್ ಆಡಿಬಲ್ ಇದ್ದಿದ್ದಿಲ್ಲ ನನಗೆ, ರೆಸ್ಪಾನ್ಸ್ ಬರಲಿಲ್ಲ.
ಇಲ್ಲ ಸರ್, ನಾನು ಮ್ಯೂಟ್ ಮಾಡಿದ್ನಲ್ಲ.
ಓಕೆ.
ನಿಮ್ದು ಆಡಿಬಲ್ ಇದೆ ಸರ್, ಜಸ್ಟ್ ವಿ ಆರ್ ಸೆಟ್ಟಿಂಗ್ ದ ಸ್ಪೀಕರ್ಸ್
ಅಷ್ಟೇನಾ? ಸರಿ.
ಅದು ಕ್ಲಾಸ್ ರೂಮ್ ನಲ್ಲಿ ಇದೆಯಲ್ಲ.
ಓಕೆ.
ಸ್ಪೀಕರ್ ಸ್ವಲ್ಪ ಪ್ರಾಬ್ಲಮ್ ಇದೆ,
ಸರಿ. ಅದಾದ್ಮೇಲೆ ಬೇಕಾದ್ರೆ ನಂಗೆ ವಾಟ್ಸಪ್ ಅಲ್ಲಿ ಮೆಸೇಜ್ ಮಾಡ್ಬಿಡಿ, ಓಕೆನಾ?
ಓಕೆ ಸರ್.
ಓಕೆ. ಹಲೋ. ಆಗಿದೆ? ಹಲೋ. ಓಕೆ. ಸರಿ.
So good morning, Yogesh sir. Am I audible?
Okay. Am I audible now?
Yes, sir, you're audible.
Okay.
So I welcome Dr. Sangeeta PG Scholar for guest introduction, sir.
Hello. Very good morning, sir. Is it audible, sir? Is it audible, sir?
Good morning. Okay, sir. Am I audible?
Okay. Dr. Asma. Um,
Yes, sir, you're audible. So I welcome Dr. Sangeeta PG Scholar for guest
Dr. Asma, I am unable to hear your voice here, but if you are able to hear my voice, so I will start the session. So if you are able to hear my voice, if I am audible, please raise your hand so that I can understand, and I will continue. Okay, thank you.
It's audible.
Thank you. Okay. So a very warm good morning to
Sir,
everyone. Respected
Sir, just a second.
Principal, SVM Ayurved Medical College, Ilkal, Dr. K.C. Das
sir,
sir,
just a
and Dr.
second.
M.M. Salimat sir, Principal, VS Ayurved Medical College. I extend my gratitude and thanks to the principals of both college for giving me an opportunity to share my knowledge with all the students at SVM Ayurved Medical College, Ilkal. And with the name of Lord Dhanvantri, I would like to start with the topic directly, that is sterilization and disinfection. Hopefully, I am audible.
Sir, it's audible for sir. Just a second. Like we'll start with the introduction, sir. Shall I proceed, sir? Excuse me, sir. So shall I begin with the introduction, sir?
You start with your introduction.
A very good morning to all present here. It's my pleasure to introduce today's our eminent speaker, Dr. Yogesh Kulkarni, sir. Presently, sir, working as Associate Professor, Department of PG Studies, Shalyatantra, BVVS Ayurveda Medical College and Hospital, Bagalkot, Karnataka. Then, sir completed his UG in DGM College from Gadag. Then, sir completed MS in Shalyatantra from BMK Ayurveda Mahavidyalaya, Belgaum. Then, sir has done certificate course in yoga from Sri Basveshwara School of Yoga, Gadag. Sir completed PhD in Paral Institute of Ayurveda, Vadodara, Gujarat. Sir has 7 years of experience in teaching field. Then sir has published 5 research articles in various national and international peer-reviewed journals. And sir attended more than 80 conferences and presented 12 scientific papers at national and international conferences. I welcome you, sir.
Okay, thank you. Thank you, Doctor, for your introduction. Even though I was unable to hear your voice, but I came to know you completed. So thank you once again. With this introduction, shall we proceed with the directly the topic?
Yes, sir, sure.
Okay, thank you. Thank you. So today we have a guest talk, and I am your guest, Dr. Yogesh Kulkarni from Bagalkot Ayurved Medical College from the Department of Shalyatantra. Okay, I am here to share my knowledge, my small knowledge with of sterilization and disinfection from the contemporary science, what we say from that is modern surgery. So just please raise your hand whenever I ask you, like I am not able to listen your voice. So just with your hand signs I can understand. So I hope I am audible. Okay, I am audible.
Yes, sir, you are audible, sir.
Okay, thank you, ma'am. Thank you. Thank you. So the sterilization and disinfection. Right. This is the slide. Okay, it is just a slide which tells you regarding much more about the two terminologies, that is sterilization and disinfection. Hoping that the topic is covered in your syllabus, now I would like to brush your information once again in related with the same topic, sterilization and disinfection. Now, see, this one single slide gives much knowledge. Now, if you ask me how, so you are saying the two things here. First is a sunlight, a bright sunlight, which is showering its light and rays over the a mountain, which is completely filled with ice, now ice mountain. Now, two things are there. One is a sunlight above, followed by iceberg below, ice mountain, and we have a very clear environment beneath in these two media, right? So one is sunlight, second is wind, and third one is ice. Okay. So it means that, let me tell you, complete sterilization and disinfection, every format of the modern contemporary science which depends on antimicrobial activity, they depend on these two things, that is sunlight as well as cold, that is environment, and third point is like wind, right? Ushnata, Shitata, and Anushna the media which is there, that is called Vatana, right? The source of energy for entire universe is sunlight. So each and every source is utilizing the sun's energy in its normal range to survive. If it changes, if it is altered, if it goes to the high temperature, then they won't survive. Similarly, with the temperature below also, if the temperature is so below that the organisms can't adapt to that temperature, then they once again die. So death of a that is a organism, that is antimicrobial activity, is dependent on either of two heat temperature or else two cold temperature. Okay, with this we'll start with our presentations of today, and my presentation contains objectives of my study, that is sterilization disinfection, with a brief introduction with the history, and introduction to sterilization with its methods classification, disinfection uske methods or classification, ayurvedic review to some point what I understood by reading some Sushruta Samhita regarding sterilization disinfection in Ayurveda, discussion summary part with conclusion and references. So objectives of my today's study is, so at the end of this session, the students must be able to understand what is a sterilization and what is disinfection, how it is classified, how it is maintained, how it is adopted, how it is practiced, right? So it would be more of a theoretical come practical knowledge oriented. So let us have a brief introduction to this. Sterilization is not a new thing, right? For Indian civilizations, Indians, sterilization and disinfection is not at all a old thing. We are practicing this sterilization and disinfection since ages, right? Since ages. That is, we are practicing salting, smoking, drying of materials, exposure to the food and clothing, that is to the sunlight. So we do many activities. We were doing, our ancestors were doing this. For what reason? It is only to get rid of microbes. Okay, to get rid of microbes, they used to do this activities, these sort of activities, and that is the reason the heading, the subject what we get sterilization and disinfection is from antimicrobial agents or activity. Okay, the heading is antimicrobial agent and activity. It means that it goes without saying our ancestors were well known and well advanced. They were using advanced technologies in sterilization and disinfection. So what they used to do? They used to do salting, so pickling. So it is also a method. अचार सभी खाते हैं अभी, ठीक है, अचार यहाँ पे बैठे हुए सभी खाते होंगे. अचार में नमक क्यों डालते हैं अभी? Why there is a salt mixed in pickles now? One thing is for a taste, right? Everybody knows it. Salt will give a taste, but second point is it will check the antimicrobial activity, that is microbial growth is checked by this salt. The lifespan of food articles are increased, enhanced with this salt. So this is how our in olden days our ancestors used to practice salting, smoking method, pickling method, drying of the materials under sunlight to check fungal growth, antimicrobial activity. Foods were exposed to the sunlight. You know, the foods were exposed to sunlight. The clothings, the dresses, the materials, the clothings were dried under sunlight now. Present day, what we are doing is we are avoiding the sunlight and we are drying under the roof now, for the reason for which the fungal infections are getting more and more nowadays, right? Because of wearing the cloths which are dried under shadow or sunlight, not under sunlight. So that is the reason. The main activity is the dresses, the clothings, the linens of the hospital management, everything should be dried under bright sunlight to get rid of infection. So next, coming to this antimicrobial agents. So keep in mind, sterilization, disinfection, it's a part of topic which I have taken today. But the other half of the topic is the third point, that is antimicrobial drugs. Among the UG students of Ayurveda BMS, everybody is well versed with the last one, that is antimicrobial drugs, which are usually taken inside orally. What is the name? It is given antibiotics. Right? Everybody knows antibiotics since their childhood. बचपन में भी अगर सर्दी खांसी हो गया तो क्या बोलते हैं? एंटीबायोटिक एक डालो. खांसी का दवा पहले, बाद में एंटीबायोटिक पहले डालो. Yes or no? So now we are acquainted with the antibiotics. Everybody is well versed with antibiotics, but keep in mind it's a last part. When there is a role of antibiotics is when we are not following the sterilization, disinfection methods properly, then there is a need of antibiotics. Okay. Now, antimicrobial agents, what is being broadly classified as 3 agents. First one is physical agents, second one is chemical agents, third one is antimicrobial drugs. Okay, you get this classification from R. Vasant Kumari, a textbook of microbiology. Right? You can make a note. It's R. Vasant Kumari, a textbook of microbiology, from where you get this classification. The heading is antimicrobial agents, and we have 3 classification under it. First is sterilization, second is disinfection, third one is antibiotics. So sterilization is thinking about antimicrobial activity. With physical agents is called sterilization, which is done outside the body. Chemical agents, the same antimicrobial activity which is brought out with the chemicals, they are called disinfection, and the process wherein which the antimicrobial activity is brought out by taking the drugs, ingesting inside your body by taking internally, those are called antimicrobial drugs. The other name is antibiotics. Okay, am I audible once again? Do spare with me. Am I audible? So today let us be a congressman. Please raise your hand and please inform me in between so that I can continue. Okay, thank you. So with this brief introduction, let us move on to some few technical terms which must know technical terms in case of sterilization and disinfection. First one being a sepsis. What is a sepsis? Everything comes from a Greek terminology here. The terminologies which have been told here, they are from Greek now. We have borrowed it now. The reason is we We are discussing about modern concept. So it tells you regarding indicates bacterial contamination. What is a sepsis? It is nothing but a putrid or decaying material which indicates about bacterial contamination, right? The organism load is so much that it is going to give a trouble to a person. So it is called a contamination of a area with the bacteria with the increased bacterial load. That is called sepsis. Now, what is asepsis? Asepsis is an absence of significant contamination. Organisms है यहाँ पे, लेकिन they are not to the number which can cause a sepsis in a person, not to the significant contamination. That is called asepsis. Okay. Now, what is aseptic technique? So preventing contamination of the surgical instruments, medical personnel, and patient during surgery. That is aseptic techniques. Hopefully, everybody knows it. Like, who is the father of aseptic techniques, aseptic surgery? Even though we should proudly say that it is Acharya Sushruta, but from the contemporary sciences, in the modern science, the person who is called with the man of aseptic surgery is Sir Joseph Lister. Okay, Sir Joseph Lister is the modern surgeon who is known for aseptic techniques, right? He brought into the picture for the first time. Next is degerming. So mechanical removal of the microbes from the hands during washing or swabbing out before giving injection is called degerming. Next is antisepsis. Now, what is antisepsis? Reduction of or inhibition of microbial growth found on a living tissue. So before doing any operation, we paint the area with a betadine or vocadine, then with a spirit, then we take an incision, right? So this process is called antisepsis, right? Yes, there are two terms, asepsis, antisepsis. Now, first one is aseptic techniques which should be followed before doing any surgery, just what I told now. Now, what is antisepsis? Now we have made an incision, we have done everything. There is a contamination, the pus has come out. Now that pus should be cleansed now. The pus should be cleansed. Now what you do, you use some antimicrobial drugs like betadine to hydrogen peroxide to clean that pus. So this is called antisepsis. Before doing the incision, what we do, painting, that is called asepsis, aseptic technique. But after the cleaning and incision, the pus has come out, and to counteract that pus, we use some drugs, antimicrobial drugs, to cleanse it. That is called antisepsis, right? And next one is sanitization, lowering the microbial counts to prevent transmission, which you have read in your park during your Swasthruta. So coming to next one, bacteriostatic agents, bactericidal agents. What is bacteriostatic? Which inhibits the growth of bacteria, does not kill them necessarily. Okay, they does not kill them necessarily. They are called bacteriostatic. So they make a static, that is, there is no further growth of organism, right? So they mutate the RNAs, which see that there is no further growth of organism, multiplication of organism. So that is called bacteriostatic agents. Okay, but what is bactericidal? The drugs which will kill, the method which will kill the organisms and checks that the number what is present, say for 10 number are there organism, it is going to kill all 10, then it is called bactericidal. Okay, then it is called bactericidal activity. What about germs? So killing the microorganisms, it is called germicidal with a later term. Viricidal, the agent that inactivates virus, everybody knows it. Virus, it doesn't have a DNA, it is not a living material. So what we can do to our best is we can inactivate a virus from its multiplication. Inactivation of the virus itself is called as viricidal activity. Next is fungicide, agent which kills a fungus. Sporicide, the agent which kills a bacteria which is spore forming. Spores which are very difficult to be killed, even if a chemical is going to kill that spore forming bacteria, then it is called sporicidal. Okay, so with these terminologies, we'll move on to the history. With a short history, I will not take much of your time. I will just brief your history, right? The reason is everything is yadricha vashat, accidental. So if you look into this history in a modern concept, how the antiseptic or aseptic techniques came, you will astonish. Now, what is the reason? See, nosocomial infections caused deaths in a 10% of surgery in a olden days, that is in mid 18th century. So, there are two persons here, Semmelweis and Joseph Lister, who were performing the surgeries, gynae OBG surgeries. So, after OBG surgeries, they saw that there is a high rate of mortality death. That is, death rate was more after surgery, after delivery. So what they thought is these are the infections which are carried from the hospital. They named it as a nosocomial infection, but they started searching. Retrospective study were done why the infection was spreading. So what used to do they used to wash their hands, directly go to the surgery, and soon after completing that surgery, once again they used to wash their hands from a water, and then they used to perform another surgery. Okay, so there were no drugs which were used to do a scrubbing at the time. They were not aware. They were unaware of totally sterilization methods. So this led to the mortality rate. The infection from one lady was carried to other. So there was increased death rate from both mother and as well as a baby. Now what they thought is, so the organisms are invisible. They are carrying the infection from one person to another. So then what they started is, they started using first antimicrobial drug, that is called carbolic acid. Carbolic acid was the first antimicrobial agent which was invented, and they started washing their hands with carbolic acid before going to perform next surgery. Right? So then they saw that there was a drastic decrease in the mortality rate of both mother and the baby. Then they thought, yes, there is a method which we should introduce and we should follow before surgery as a standard operative procedure, and they named it as aseptic surgery. Right? That is the reason the name goes for Sir Joseph Lister, who is the father of modern aseptic surgery. Okay, this is about invention of surgical technique, sterilization method by washing their hands with carbolic acid. But if you look into picture, what they started is, they started with the burning sensation of the hands. Okay, if you proceed with the invention, they started with burning sensation. Carbolic acid is a phenol variety. So when they started with the burning sensation, they started wearing something which is called red rubber, which was taken from India now. Okay, Indian rubber was famous at the time. They used to import Indian rubber, and they used to wear a rubber gloves made out of a red rubber, and used to perform surgery to get rid of the burning sensation of the carbolic acid. So what they invented? Red rubber gloves. Later they went on inventing the surgical gloves, which we are seeing now. Okay. So it is not that surgical gloves were invented purposefully. It is just a yadricha vashat to safeguard the surgeon's hands. They invented a surgical glove. This is how the history goes. So whatever it is, sterilization techniques was invented in mid 18th century by modern people, and Sir Joseph Lister was the person. So coming to other brief history, you must be knowing this. Chlorination was invented in the 1890s, and chlorine, that is in World War I, chlorine gas was used as a chemical warfare agent. And pasteurization of milk, you are seeing in the right side, Louis Pasteur. Okay, so who invented pasteurization of milk to increase the lifespan of a milk. And sodium hypochlorite and calcium hypochlorite, even today we are using this. So even in your COVID-19 conditions, they were using this material to sanitize the area. So they were the part of sterilization techniques which were introduced long back. Okay, with this brief history, let us move on to mode of actions. If you understand these four methods of mode of actions, you'll be able to place where the sterilization is and where the disinfection is, right? So what is that? The mode of actions of each and every sterilization techniques and chemical agents, that is disinfection, they fall under these four categories. वो क्या करता है अभी, they either of damage to the DNA of a bacteria or a virus or a fungi, and they do protein denaturation. What they do, so you have an organism, bacteria, which are made out of the cells with the plasma, mitochondrial cells, everything. Along with that we have a DNA strands, RNA strands. Now what does these sterilization and disinfection techniques do in reality? So what they do is they damage the DNA. They basically they go and break the protein chain which is meant for the DNA multiplication, right, duplication. So what they do, they damage the DNA, thereby it checks the protein denaturation and which is responsible for the multiplication of the organisms. Okay, and few methods what they do directly is they disrupt the cell membrane. Okay, so there is a cell now, the cell is present with its material inside. Once there is a break in the cell wall or cell membrane, there is a leakage of the plasma and the contents of the bacteria cell. So once there is a leakage, the cell is going to shrink and it is going to die, right? This is the other method. So next is a chemical antagonism. So drugs are given which is going to mismatch the protein chain and going to cause a protein denaturation, thereby inhibiting the multiplication of the bacteria or fungi or viruses. So in these four basic methods, the mode of action of each and every antimicrobial agents, let it be a sterilization, let it be a disinfection or a antibiotic drugs, is going to act on. Okay, so coming to sterilization, the first part till here we had the sterilization basics, and now we'll enter into the main part of the presentation, sterilization. What is it? It's killing or removing of all form of organism, that is microbial life, including endospores in a material of a object. It is a sterilization. Sterilization, what it will do? It will kill all forms of organism, including the endospores, which are very difficult to be killed. Okay, which can withstand to extreme temperature. That is the reason it is very difficult to kill endospore, but sterilization method it kills everything. Okay, and which is the commonest method? Heating is the very commonest method among sterilization. That is the reason I told you in the starting slide regarding the sunlight and its capacity of doing antimicrobial activity, right? So next is commercial sterilization. We think sterilization is our own like it is a method which is related only with the surgery. Just like how presently the modern people are thinking surgery is only their own intellectual property rights, they only should do a surgery. It is not so. The person wherein which everybody knows about it, they can perform it. Just like a commercial sterilization. Sterilization is not only used in a surgical procedure, they are also used in a commercial sterilization, wherein which canning of foods are done. The food articles are lengthened with their lifespan by treating them with the infrared radiations and some other chemicals to kill the organisms which are responsible for rotting of the food articles. So one such example is been given, botulism, and Clostridium botulism was a causative organism. So in World War, the meat and the milk which were supplied to the soldiers, to increase the lifespan of the meat and the milk products which were supplied to the surgeon, they started with this. So they started canning the materials in a plastic material and then treating with the chemicals, that is commercial sterilization method. So thereby increasing the lifespan of food articles. Okay, so this is about chemical sterilization. So this is a broad classification which you get in a Vasant Kumari textbook regarding the sterilization. First one is heat, followed by radiation. Third one is ultrasonic vibration. Fourth one is filtration. Okay, and under the heat we have dry and moist heat. Under the radiations we have ultraviolet radiation and ionizing radiations. And in ultraviolet radiations is very common, but ionizing radiations include gamma rays, X-rays, right? In case of ultrasonic vibrations, so it is said that the vibrations which are spreading, the vibrations which are created with the normal wavelength, they can create a antimicrobial activity. They can kill the, they can break the cell wall or cell membrane of a bacteria, right? So it is thought to be, and it is placed as a physical agent. Next is filtration. That is earthenware, asbestos, and millipores. These are some part of methods of filtration. So keep in mind, स्टेरिलाइजेशन एक ऐसा मेथड है जहाँ पर एंटीबैक्टीरियल और एंटीमाइक्रोबियल एक्टिविटी किया जाता है with what, with using the physical agents like heat, temperature, radiations, filtrations, which are not chemicals, they are just physical agents, right? They are all physical agents, right? So let us see first one, heat. So heat, wherein which the organisms are denatured by their DNA strands and enzymatic activity by denaturing the protein of a bacteria. So it kills the organism by oxidation effects, right? So under this category, we have three. One, heat, which we use at hospital setup: direct flaming, incineration, and hot air sterilization. So direct flaming, which we see in inoculating the loops and needles very commonly, direct flaming it is called. Incineration, we dispose of the some of the items and biological waste by incinerating them, burning them. And a hot air sterilization is using the hot air ovens where the materials are exposed to 2 hours at 170 degrees Celsius for sterilization, right? These are some methods of dry heat method, right? Dry heat method. Okay. Hopefully the audience are clear. If any doubts are there, you can raise your hands. If I am not audible, you can raise your hand in the middle and you can stop me there. So coming to the moist heat. So the moist heat, it kills the organism by coagulating the proteins. See, once again, it kills by denaturing the protein molecules which are responsible for DNA strands formation, multiplication of an organism, right? Now, this is the effective method of sterilization, which is like boiling is the one. Heating to heat up to 100 degrees Celsius or more than at the sea level kills almost all pathogens with the spore forming at 10 minutes or less even 10 minutes. See, this is the importance of boiling. That is the reason our old GP practitioners, right? GP practitioners, they what used to do is they used to use a glass glass syringes, right? The syringes which were prepared out of glass, which are resistant for heat and temperature. So that is how after using once they used to place it in a boiling water. So even now you go and visit some of the villages, remote places, you can't expect a disposable syringe, insulin syringe, every syringe for each and every treatment modality. What they use, a one single syringe with a glass material after repeated boiling, that boiling method which is of a moist heat, right? And then wiping it off with a clean cloth. So this is to be done. They were using this, and it was done in olden days. And let me tell you, even in few of the orthodox institutes, they do this practice of using a glass instrument as a syringes and following this boiling method, right? So next is in hepatitis virus and endospores, they are killed. See, hepatitis virus, it is known for its survival even after 30 minutes, right? After this exposure to the boiling. Just you can imagine. So how the preparation of these viruses, right? These viruses, how they withstand the temperature. So recently we had COVID virus and everybody were saying that the people from the heat temperature, that is the persons from Ballari, Gulbarga, Raichur, they can survive, they will not be inflicted with the COVID virus, not at all. The viruses, they can withstand extreme temperatures, right? They can modify themselves, they have a very protective shield. So that is the reason the COVID shield has come, right? The reason is COVID shield is the vaccine shield. The reason is the vaccines have got a protective shield. To protect from that COVID, we have COVID shield, right? So that is how hepatitis virus, it can survive extreme temperature. So that is the reason we need to have this boiling method to kill that organism. Endospores can survive up to 20 hours of more after exposure. So just imagine how these endospores can survive. That is the reason rabies, tuberculosis, where the endospores are formed, those diseases are very dangerous, very grave. Surface virus, hepatitis surface, HBsAg, why they are very grave? They can survive even after boiling. Okay, if you think you have washed the hands with the spirit, or you have burnt the instrument with the fire, it is not sufficient. Keep in mind, it is going to even survive and carry the infection for next. So that is the reason care should be taken. Next, among this moist sheet, the best and the internationally accepted method of sterilization is autoclave. Okay, so this is the best method. So we have different types of autoclaves: horizontal, vertical, double bin, single bin, low pressure, high pressure. Okay, in this autoclave, we have different varieties of autoclave machines. We have autoclave machines of 30 feet height. Okay, just more than a building size, 3-story building. We have 50 feet height autoclave machines. We have horizontal machines just like a missile. Okay, so what is this autoclave machine? It is the instrument wherein which the instruments are kept and the steam is pushed inside with pressure. Steam is pushed inside with pressure, and the moistness of the steam is going to kill organisms at 121 degrees Celsius. Keep in mind the temperature of the steam should be at 121 degrees Celsius. So then only there is a killing of organism, bacteriocidal activity. Right? It is the most effective among all the methods of sterilization. It is the most effective, and all organisms with endospores are killed at within 15 minutes. Just imagine, within 15 minutes, all the organisms are killed. Now you just compare the procedure with that of your sudation method. Okay, sudation box which you usually perform in your Panchakarma unit. Okay, in your Panchakarma unit, the person is made to sit in that and everything is closed and you are exposed there for 15 minutes. What not you can expect there? Svedana Karma, steam is there with pressure we are providing steam there. Okay, so antimicrobial activities, removing of the blobs which are present on the skin, srotases are cleansed, everything is done, right? So that is how most of our Ayurvedic procedures, with they directly or indirectly, they tend towards the antimicrobial activity, but we don't term that antimicrobial activity. That is the reason, right? Okay. So this is autoclave machine and autoclave method, and worldwide all the instruments, all the blunt instruments, artery forceps, Alice forceps, sponge holding, etc., etc., everything they are autoclaved in this instrument, right? Autoclave machine. Hopefully, you have seen in your hospital regarding this instrument, and it is the best method, right? The what is the disadvantage is requires more time to reach at the center of a solid and large volumes of liquid. So whenever we subject any materials for autoclave, we should see that the center of the area of the presentation, that is, we are keeping a bin. So 5 bins are kept. So it should be thought that the steam to reach at a middle aspect, middle layer of a bin takes a time. So we should give a proper time. So there is a time for each single pressure, single bin. If it is there, we should go for 45 minutes. If it is a high pressure autoclave machine, 30 minutes are enough. Okay. So once again, we should read out the manuscripts which are present on the each autoclave machines to operate it. Okay. Basically, it is 30 minutes to 45 minutes at 121 degrees Celsius to have this activity of autoclave machine. So pasteurization, so classical method of pasteurization. So hopefully it is preventive medicine में आपने पढ़ा होगा इसको, to enhance the lifespan of a milk. So milk is exposed to 65 degrees Celsius for 30 minutes. It's a classical procedure of pasteurization. Later we have come with UHT, HTHT, that is high temperature short time pasteurization, ultra high temperature pasteurization, wherein which you can just see the temperature is more, exposure is less. Exposure of the milk, you can see there in the first one 72 degrees Celsius and 15 seconds. The time period has reduced now, and you can see the third one 140 degrees Celsius and just 3 seconds. It is called flash method. What it is? It's called as a flash method. So the milk which is treated in this can be kept for a months together. That is 3 months almost. So that is how we get a toned milk. Okay, in our parlors we get toned milk, right? KMF supplies that. So 140 degrees Celsius. Just imagine we are unable to survive. We suffer with a heat stroke, sunstroke of a 70 kg body for just 40 degrees Celsius. 40 पे हम लोग मर जाते हैं. There are incidents wherein which the militants, military persons, they die because of extreme temperature. Who are trained in extreme temperature, they die because of temperature. Now just imagine now, what would be the status of an organism present on a milk now? It is 140 degrees Celsius, 3 times more the temperature of what is presently here. So that is how no organism can survive. So this is very extreme. So that is the reason exposure time is very short, 3 seconds, and milk can be stored at room temperature for several months. Okay. So whatever inventions occur in and around us, so as it is said by a great person that necessity is mother of inventions, right? Necessity to protect the milk from spoiling. So there was a necessary at that time. So what they started with Louis Pasteur is these methods, right? So that is the name, the person name has come to it, like pasteurization, right? Coming to filtration, removing the microorganism passing through small pores. So commonly done, we use a cotton material for filtration. Okay, no persons in our home side they are trained for sterilization, but you can just see that the intelligence level in our Indians, they purify each and every materials before they use, right? Before they use, they purify it, right? Even the water is purified when we collect it from a morning from a tap water, right? We start our sterilization methods from since morning. Okay, morning सुबह से चालू होके रात पे बेड टाइम to have a milk at bedtime. Even we filter the milk and then we drink a milk, right? So this is how the sterilization is a part and integral part of our life. But here we are discussing only in relation with surgical. Okay. So filtration here. So we have sensitive filters which are made of different enzymes, antibiotics, culture medias, membranes are there. So one such membrane is HEPA filters, high efficiency particulate air filters, which are usually used in laboratories. Okay, serum institutes where they are manufacturing the vaccines. So they use these HEPA filters. So the complete rooms are filtered, they are plastered with the HEPA filters. No air can enter, no air can exit. Okay. So such a closed unit will be there where the complete sterilization of the room is done with these HEPA filters. Next is membrane filters. So usually these are used for filtering the blood substitutes, blood components. Okay. Membrane filters are usually used for filtering the blood components from serum and etc. So you can just see there 0.22 nanometers, very fine, invisible, जो दिखता भी नहीं है ना पकड़ में आता है. Such a small microorganisms are there which are filtered through this membrane filters, and you can see there indications where they are used in industries and research laboratories where they prepare vaccines and many other, right? And you can see the 0.01 nanometer for pores are there for to filter the viruses, right? Viruses, they are all very small particles are there which can even retain there, right? So coming to the next one, low temperatures. I told you refrigerator, the source of low temperature snow, what I told you previously. Effect depends on microbes and treatment applied, like the where how we do it, right? So we have two parts, very importantly speaking, in this refrigeration, freezing. Okay, you can see this refrigeration temperature of 0 to 7 degrees Celsius, where we can expect bacteriostatic effect, right? Whenever the materials are exposed to a low temperature refrigeration, क्या होता है? What will happen is the metabolic rates in the microbial growth microbes will be reduced, inhibited. इसीलिए क्या होता है? Whenever the tomatoes or any of the vegetables are kept in a refrigeration, what we expect there? What we expect is the organisms which are present over it and they are going to cause rotting, they are inhibited. So that is the reason they will never get rotten. The tomatoes they get never rotten, right? So what they cause is they'll keep it safe and for a long duration. This is called bacteriostatic. Freezing is bactericidal. In that we have flash freezing, slow freezing, which can kill organism very quickly by disrupting the cell membrane, right? So this is the method. Please keep in mind, refrigeration is not a good method. It is only good for surgical perspective, not for healthy living being. रेफ्रिजरेशन में अगर आप ऑर्गेनिज्म कुछ मटेरियल्स रखते हो तो ऑर्गेनिजम्स विल स्टे ऑन इट एंड यू आर ईटिंग द सेम ऑर्गेनिज्म. सो द बेस्ट मेथड इज फॉर हेल्दी life. What you should do is the materials which are kept in a food articles which are kept in a refrigeration, after taking it out you should wash it properly, then only you should use it. Okay. Second is freezing below 0 degrees Celsius, minus degree Celsius, which can kill organisms, most of the organism, by disrupting the cell membrane. The crystals which are formed will directly perforate the cell membrane and the cell wall and can leak out the plasma and causing the shrinkage of the cell, thereby cellular death. Regarding radiations, so there is a image which is displayed on in front of you with its wavelength and from the corrosive to that of a normal. So gamma rays, X-rays, UV rays, they are more corrosive. They can perforate, penetrate your body. So they are used for sterilizing the OT units and major materials in a large sector. But in case of infrared, microwaves and radio waves, in a short sector, like small sector, we can use it. Ultraviolet radiations and infrared radiations, they are usually used in case of sterilizing the small units. Okay, small OT units, clinics, etc. Okay. So, and the X-rays, gamma rays, they are used to sterilize the instruments which are implanted inside our body, like IM nailings, intramedullary nails, the screws, the dynamic compression plates, the one which are used inside our body, those are sterilized very properly by these gamma and X-rays, right? So we have two varieties, ionizing and non-ionizing. So gamma, X-rays and electric beams of higher energy, they are used and they cause mutation in a DNA. Peroxides are formed and usually used in pharmaceuticals and medical disposable food industries, where the instruments are treated with these gamma rays and then later they are packed. Okay. So we have seen suturing materials, needles, catheters, instruments. So everything they come in a sterilized pack, right? So they are sterilized in this form, that is ionizing radiations. The only problem with this is they perforate and penetrate the human tissues. So genetic mutations can even cause in a human beings. So that is the reason the persons who are working in these areas, they are having this some of the complications. Okay, so they should protect themselves with that radiations. Coming to ultraviolet radiation, which are among non-ionizing radiation, even we use it in Kshara Sutra cabinets for sterilization. Wavelength is not more than 1 nanometer, damages DNA. Thymine dimers are found which causes mutations. Disadvantage is damages skin and eyes, does not penetrate paper and glass and cloth. So that is the reason we are using this. Even though it is having corrosive action, but its advantages are more than the disadvantages, right? So that is the reason it is in use. And last one, microwave radiations. So this has been seen in killing vegetative cells in a moist food. Solid foods are unevenly penetrated by these microwaves. That is the reason. So you should always keep in mind, fresh food must be taken for eating. Okay, food habits should always include fresh food. Okay. So with this, we'll have a summary of this. So this is a summary chart wherein which moist state, boiling, moist temperature, autoclave, that is pasteurization, dry flame, incineration, filtration, cold, that is cryopathy, cold refrigeration, osmotic pressure, that is adding salt, radiations, and strong IV lights. These are some of the methods and mode of actions for physical events. Okay. So shall we move on to the disinfection? Okay, we'll move on to the disinfection now. So what is disinfection is? It is once again bringing about antimicrobial activity with the help of chemicals. The only difference is chemicals. There it was physical agents, now it is chemical agents. But keep in mind, it is not going to cause 100% sterilization. Okay, it is going to retain some of the organisms. So that is the reason sterilization is 100% of bringing about antimicrobial activity, but not the disinfection. So disinfectant, they are applied in inanimate objects, antiseptics. So we have seen this. So this is important. So the ideal disinfectant, that is ideal chemical, which is going to do either antiseptic or disinfectant activity, how it should be. So these are the points. It should be resistant to inactivation whenever we use. So the commonest antiseptics or disinfectants we use is betadine, hydrogen peroxide, spirit, surgical spirit, right? Acryflavin, right? So there are a few drugs which are from tincture benzene, iodine, chlorine. So these are chemicals which we commonly use in our practice. So how they should be is resistant to inactivation. Whenever we use it on a person, it should not get inactivated. Second is they should be broadly active. They should kill all sort of organism. That is bacteria, viruses, protozoans, fungus, etc. Third is it should be not a poisonous. It should be a non-poisonous material. So that is the reason, even though it is a non-poisonous, but always keep in mind it is always prescribed, or it should be kept away from the sunlight, direct contact with sunlight, direct contact with the children's, and from skin and conjunctiva, that is eyes. So on contact, it can cause some of the corrosive action. Penetrating, it should penetrating only to the pathogens or pyrogens, not the persons. So it should be prepared in such a fashion, and ideal disinfectant should be and not damaging to the non-living materials. So what it is, it should be not damaging to the non-living materials. The materials with which we use it, it should not get damaged. Say for example, we are using this hydrogen peroxide in a bottle. If every time the bottle is getting damaged, so there is a need of a new bottle every time. So that is how it should not damage the non-living materials with which we are using it. So that is the ideal disinfectant. It should be very stable. It should be easy to work with. Very important. Please keep in mind, it should be easy. अगर ये difficult हो जाता है, it is difficult to work with these disinfectants. So probably each and every house should have a doctor there. Okay, for what reason? For cleaning the floors, for cleaning the glass material. ठीक है, अच्छा है कि क्वालिफिकेशन हम हमारे यहाँ पे आया को दिया जाता है वो काम, वरना क्या है, इफ इट वाज वेरी डिफिकल्ट टू ऑपरेट विथ, सो जस्ट लाइक एंडोस्कोपीज और सर्जरीज, बिलरॉथ 1 बिलरॉथ 2, जहाँ पे डिफिकल्ट है, अगर केमिकल से हमको उतना ही डिफिकल्ट है प्रैक्टिस में लाने के लिए, तो डॉक्टर से पोछा लगाना पड़ता था. ठीक है, सो दैट इज द रीजन देयर इज नो नीड. It is very easy to handle these chemicals. That is the reason there are some other persons to handle these chemicals. Otherwise, non-unpleasant, it should be a pleasant one. So these are some of the ideal materials. Okay, let us see the disinfection classification in a broad sense: high level, intermediate, low level. Okay, usually the chemicals of disinfection are divided into these three. High level disinfectants, which are used in laboratories, serum institutes, very big institutes, industrial areas, where they prepare vaccinations, where they prepare antibiotics, right? Where complete disinfection is must. There they use higher level. Intermediate level, a hospital setup. Okay, a hospital setup, IP setup, inpatient setup, intermediate level. Low level disinfectants, clinics. Okay, at our clinic level, we should use this low level disinfectants. We can even use this low level disinfectant at home also, right? Just like a Dettol, we use it at a home, right? So there is no need of any person to insist how to use it, Dettol. That is the reason low level disinfectants, Dettol, Savlon, they can be used at a home also. So let us see some of the, very quickly we will see some of the chemical methods of microbial growth. That is phenols and phenolics. Phenols are the primitive chemicals which were first introduced by carbolic acid. I told you, Sir Joseph Lister introduced it, and first phenol which was introduced was carbolic acid. Usually it is a CET question and usually a viva question also, right? Which was the first chemical which was used as a sterilization or disinfectant. It is carbolic acid, right? And who introduced it? Sir Joseph Lister. Rarely used today because of its skin irritant and has strong odor. And even today they are using it on a throat sprays as a lozenges and acts as a local anesthetic. Because of its wide range of activities, they were using these phenols like carbolic acid in olden days before surgery. Some of the derivatives of phenols, they are called as phenolics, derivatives. Just in change in the structurally, they make it a phenolics derivatives. Commonest are crisols, biphenols. The common is lysol, which is a coal tar derivative, lysol. Okay. Usol, there is another material usol, that is Edinburgh solution, EUSOL, Edinburgh solution, which is also a phenolic, that is effective against gram-positive and streptococcus organism. What is the advantage? They are stable, they are persisting for a long time after application, and it remain active even in the presence of organisms. So these are the advantages. Whenever we use these phenols, with this advantage, they are still in use. Okay. Coming to second variety, second method, like halogens. If you remember, once again, if you go back to your secondary education, 10th or PUC, we had a last group of drugs in a periodic table. Okay, in chemistry, we had a last group of drugs which were called as a halogen group of drugs with a negative ion. Okay, chlorine, fluorine, iodine, right? So they were halogen group of drugs. What they are used? Effective alone or in compounds. The first commonest is iodine, and the oldest antimicrobial agent was tincture iodine. What is this tincture iodine? Iodine is extracted in alcoholic base. Then it is to be called as tincture iodine. Okay. So it is the first antiseptic used. Okay. Antiseptic. Now there are two terms once again. What is that? Antiseptic, disinfectant. In the heading of disinfection, we have two terms, antiseptic, disinfectant. Now, what is the basic difference? Antiseptic are used on human beings, that is animate objects. What is disinfectant? They are used on inanimate objects like floors, tiles, table, etc. लेकिन antiseptic क्या है? They are used on human beings, just like iodine, betadine, vocardine, spirit, etc. Okay. Okay. With this, iodine, the first variety of antiseptic which was used in olden days. So this is antiseptic. Please keep in mind antiseptic. First sterilizing agent was carbolic acid. Okay. So this is about iodine and tincture iodine. It is still in use. And iodophers. What is iodophers? The derivatives or the compounds of iodine are called iodophers. So slow releasing, and it takes several times for to act on. So used on skin antiseptic in surgeries, not effective against gram bacterial endospores. Keep in mind, the commonest examples are betadine, isodine, vocardine, povidone, iodine, etc. So this betadine is called povidone iodine. And what is this once again povidone? It is called a PVP1. The compound which is added to it is called PVP1, that is called polyvinyl pyrrolidone. Okay, polyvinyl pyrrolidone is the compound which is added to iodine to reduce the corrosive action of it and making it as a usable one. That is called betadine, vocardine with the trade names, right? So it is used on skin for before surgery. So painting. So in all the surgeries, the painting, degerming of the skin is done with this betadine. Okay. Next one is chlorine. When mixed with water, hypochlorous acid HOCl is commonly formed, which is the best antimicrobial agent with the chemical formula. Sodium hypochlorite is another one, and chloramines are the other, where which ammonia is a part of it, and they are the best bleaching agents to sanitize the public areas like pools, toilets, sanitary areas, drinking waters, etc. We use this hypochlorous acid and hypochlorous acid and sodium hypochlorite. So we have seen this extensive use of sodium hypochlorite in nowadays because of COVID-19, right? Next, coming to the very important one, third one, that is alcohols. Kills bacteria, fungi, but not the endospores or viruses. Very important. Keep in mind, all it acts by denaturing the proteins and disrupting the cell membranes, but it does not kill an endospore. Keep in mind, does not kill an endospore. So don't be in a dilemma. If you touch a patient of HIV, HBsAg positive patient, then you wipe out your hands with the spirit. Don't be in a dilemma. You are okay. Okay, the organisms are killed. No, not at all. Alcohol is not at all a safe material for infective materials in like HIV, HBsAg. Okay, but keep in mind when they are used to mechanically wipe off the organisms before giving injections or blood drawing, etc. The commonest is ethanol and isopropyl alcohol. Ethanol is called drinking alcohol with optimum of 70% concentration, and isopropanol is called rubbing alcohol. So the one which is used for rubbing. So this is famous nowadays. Isopropanol is very famous nowadays because of its use in the COVID. That is rubbing alcohol. But keep in mind, as I said you, it is never going to kill a virus, nor it is going to kill a bacteria, spore forming bacteria. So it is of no use. Got? So it is of no use to wipe out your hands to get rid of COVID virus. Next, heavy metals like silver, mercury, copper, told in modern contemporary science, but in our Ayurvedic text in Dravya Sangrahani Adhyaya, it is already explained that hello. ಹೌದ್ರಿ ಹೌದ್ರಿ ಏನು ಮಾಡಂದ್ರಿ ನೀವು ಲೈಕ್ ಓಕೆ ಓಕೆ ಮೇಡಮ್ ಹೇಳಿ ಮೇಡಮ್ ಹೇಳ್ರಿ
ಏನಿಲ್ಲ ಸರ್ ನಮ್ದು ಸ್ಟೂಡೆಂಟ್ಸ್ ಗ್ರೂಪ್ 11:15 ಇಂದ 11:30 ತನಕ ಪ್ರಾಕ್ಟಿಕಲ್ ಕಂಡಕ್ಟ್ ಮಾಡಬೇಕು ಅಂತ ಕೇಳಕ್ಕೆ ಸಿಗ್ತಾ ಇದೆ ಸರ್.
ಮೇಡಮ್ 15 ನಿಮಿಷ ಮಾಡಿ ಆಮೇಲೆ ಮೇಲೆ ಶಿಫ್ಟ್ ಮಾಡಿಸ್ಬಿಡ್ರಿ.
ಓಕೆ ಸರ್.
ಓಕೆ ಓಕೆ. ಹಲೋ, ಹಾಂ ಹೇಳ್ರಿ. ಹೌದ್ರಿ, ನಾ ಕ್ಲಾಸ್ನಾಗ ಇದ್ದೆ ರೀ. 11:15 ಮುಗಿತು ಕ್ಲಾಸ್. ಹೌದು, 15 ನಿಮಿಷ ರೀ. 11 ಸ್ವಲ್ಪ ಕ್ಲಾಸ್ನಾಗ ಇದ್ದೆ ರೀ. ಸ್ವಲ್ಪ ಹೇಳಿ. ಹಾಂ, ಓಕೆ ಓಕೆ. ಸುನೀತಾ ಅಂತ ಒಂದು ಒ ಪಿ ಡಿ ಹೋಗ್ರಿ ಒಂದು ಪೇಷಂಟ್ ಅದ ಸ್ವಲ್ಪ ಹಿಸ್ಟ್ರಿ ಎಲ್ಲ ತಗೊಳ್ರಿ. ಸರಿ ಸರಿ, ನಾನು ಕ್ಲಾಸ್ನಾಗ ಇದ್ದೀನಿ, ಬರ್ತೀನಿ. ಹಾಂ, ಓಕೆ, ಸರಿ.
Silence.
Okay.
So you can
Video
continue.
and audio both, I think both have resumed. Okay. Shall I continue? Okay. Thank you, ma'am.
Yes, sir.
So we have discussed regarding the alcohols, right? Alcohols, and let us move on to. So I was saying in alcohol that ethanol, drinking alcohol, and isopropanol, that is rubbing alcohol, both are not safe when we stand in front of a virus, right? The reason is it is never going to kill endospores, or it is never going to do inactivating the viruses. It is just for advertisement that it is going to kill a virus, never. So, okay, don't be in a dilemma. If you are exposed to a patient of a virus by just alcohol, you are not going to be as safe now, right? So moving on to the next one, heavy metals, which says about the use of silver, mercury, and copper in olden days. Let me tell you, Acharya Shushruta has included Trapyadi Gana in Dravya Sangrani Adhyaya, right? Sushruta Sutra Sthana 38th chapter, Trapyadi Gana, where he has told Naga, Vanga, Sisa, Tamra, Rajata, and Suvarna. The materials of iron, gold, lead, copper, bronze, everything, he has told how they can be best utilized for antimicrobial activity. Okay, so that is the reason we have copper, Tutta, as a part of Jatyari Taila. Tutta is present in a Jatyari data, that is copper sulfate, which is the best antimicrobial Shodhana material. So that is the reason. So if you look into the picture of modern concept, silver is a 1% used as a silver nitrate in both the ointments which are used on gonorrheal eye infections, mercurial products like merthiolate or mercurochrome, very commonly used on skin disinfection. Next is a copper, which is used to kill algae in pools and fish tanks. See, the usage is very minimal. What I mean to say, the usage is very minimal when we compare with the Ayurveda and modern references. We have very good reference on use of broad spectrum, but in modern it is not so. But once again, they are behind our Ayurveda for such research activities. They will come up with the newer drugs with metallic compounds also in future. Next, coming to the quartz, with a short name as a quartz, it is called quaternary ammonium salts. So these are the quaternary ammonium salts, very widely used nowadays. Let me tell you, these are widely used detergents, disinfectants all over the world. Okay, with the common name like zafarin, zapicol, sapacol. आपके घर में जो मटेरियल्स आते हैं वो इसी में से आते हैं, राइट? ठीक है, जो फिनाल जो फ्लोर क्लीन करने के लिए आता है, सेपेकॉल, ग्लास वेयर्स क्लीन करने के लिए जफेरिन. So they are used in hospital setups to clean the wipe out the glass materials, utensils, etc. Okay, so advantages: they are strong antimicrobial activities, colorless, odorless, tasteless. They are very stable, and moreover they are non-toxic. Okay, they are non-toxic. They are used. What is the disadvantage? Foam forming. So any disinfectant or detergent, they are foam forming. So whenever they are used on organic material, they interfere with their effectiveness. So that is the reason these chemicals, phenols, can't be used to clean or wipe out the blood stains, abscess, that is pus cavities. They are not used. Next, so this is the image in your right corner. You can see these bottles. Sepacol commonly used and it is widely available. Coming to next, very important and very commonly used in Ayurvedic colleges even. Which one? Formaldehyde. Okay. Hopefully we are aware of these two, that is alcohols and formaldehyde in our college. In every Ayurvedic hospital, these two are very commonly used, alcohols along with aldehydes. Which one? Formaldehyde, excellent disinfectant, formalin and 38% aqueous solution, causes and used in preserving the biological specimens, and it's a best antimicrobial agents used even for mortuaries. Even mortuaries, it is used for embalming the dead bodies. And what is expected here? It is excellent disinfectant, and another derived form which is called glutaraldehyde. Everybody can make a note. This glutaraldehyde is one such chemical which is also a sterilizer. कहने का मतलब है ये एक ऐसा केमिकल है जो कंप्लीट एंडोस्पोर्स को भी मार देता है. Okay, it can even kill endospores. It is only one among the few chemicals or disinfectants that is even a sterilizing agent. Okay, it's a CET as well as Viva say question. So where you get this you get in a hospital setup in a endoscopic surgeries, wherein which the endoscopes are cleansed with this solution. Everybody must be knowing this who have worked in hospital, that is Sidex solution. Okay, Sidex solution is a content is glutaraldehyde. So usually after doing endoscope, the pipes, the tubes are cleansed with this Sidex solution. Content is glutaraldehyde. It is more strong and effective than formaldehyde. Okay, bacteriocidal, tubericocidal, and virucidal in just 10 minutes. Okay, and sporicidal in 3 to 10 hours. So commonly used to disinfect the hospital instruments and used in mortuaries. Coming to gaseous sterilizers, presently I don't feel these are present, but in a long back, that is in olden days, they used to sterilize their autoclave, complete linens, clothing materials, patient gowns, etc., towels, by doing this gaseous sterilizer. That is, ethylene oxide was pushed inside a room chamber with pressure, which can kill microbes and endospores even just in 4 to 18 hours. Right? So this was done in olden days with the chambers which were called as ethylene oxide chambers. Okay? Ethylene oxide chambers. Presently we have autoclave instruments with a big size. In olden days they were doing with this gaseous material. Peroxygens, commonest is ozone, which can kill and denature the bacteria, neutralize the unpleasant tastes and odors, more effective killing agent than chlorine. That is the reason we use it commonly for pus filled cavities. To cleanse the pus filled cavities, we use this peroxygen, that is commonest is hydrogen peroxide. Okay, used as an antiseptic, not good for open wounds. It coagulates the proteins. इसीलिए शुद्ध व्रणों में इसको यूज नहीं करना चाहिए. It is effective as a disinfectant in inanimate objects. sporicidal at higher temperature. So even this is a sporicidal at higher temperature. So with this we complete the disinfection, and with this summary slide, and rate of microbial death, it depends on these four factors, that is number of microbes, types of microbes, environmental influences, and time of exposure. So I told you autoclavation, they should be used for 40 to 45 minutes to have a good action. Pasteurization, different timings are there, 3 seconds at 140 degrees Celsius for flash method. So that is how everything depends on these four factors. Okay, hopefully I have completed the modern concept of sterilization and disinfection. Let us have a very brief, very short of 5 to 10 minutes regarding our Ayurvedic perspective. The reason is I am an Ayurvedic surgeon. I should speak about Ayurvedic review and perspective. So let us see how beautifully our acharyas have told this method in olden days. So if you look into the Smritis, okay, the oldest texts available on planet, like we call it as Smritis, right? Shruti and Smriti, Smriti among which the Yagnavalkya Smriti and Manusmriti are the oldest. We get the direct reference of Jala Shuddhi by Vastra Ghalana. By with the white cloth, we used to do Jala Shuddhi to get rid of the organisms, microbes. So this is the first method, which is called as physical method of sterilization. Next, snana after touching a dead body, taking a bath after touching a dead body. We feel that it's an orthodox or something XYZ, and we call them it's of waste. So presently we don't do that. But what is the reason? There is a microbial growth. Death of a tissue will cause microbial growth and is going to cause spread a disease. That is the reason whenever we touch any dead body, we should come and take a bath. That is was explained in a Manusmriti, right? We take it as a religious concept and we leave it, but keep in mind there is no religion in our ancient valley civilization. Whatever things has been told here, they were following a scientific background, they were having a scientific reasoning behind it, right? So next, coming to Hamsodaka, everybody knows it. I must have heard the shloka, diva divakare karanishir santaptam rajatam toyam agastena vishikritam kalena pakvam pane amrutopam, right? So what is the beautifully told here is the nakshatra is going to detoxify the water in the lakes in the daytime, and it is going to be cooled at the night, making it as a nectar. Okay, it is so beautifully told, right? So what it is going to do? It is going to disinfectant the water. Physical method. Okay, there is no chemicals used. Disinfectant is a physical method, and that is equivalent to the nectar. It means that whenever anything is devoid of any organism, it is equivalent to a honey, nectar. That is the reason it has been told as Hamsa Udaka, Hamsodaka. Next, we have Vruna Shodhana and Ropana Ganas by told by Sushruta in Amapakveshani, the 17th chapter Sutra Sthana, right? So Shodhana Ganas, which cleanse the organism by killing them, bactericidal activity, right? Sankramika Roga, we have told Prasangat, Gata Samsparshat, Sashanat, Samalyanolepat. We have told the pathology as disease spread, Sankramika Roga. Sushruta has told it very clearly in disease, that is Vyadhi Samuddeshi Adhyaya. Now what it tells? Spread of a disease. Now how it spreads and what measures to be taken to get rid of, presently we are following in our COVID protocol. Okay, presently we are following it. We are not wearing one person's dresses. We are keeping our known persons away, social distancing. We are not having food from the same plates, right? The etiologies for Sankramika Roga, which was told by Sushruta, it is followed presently nowadays, right? It is better late not than never, right? It is being practiced, right? Next is Dhupana Raksha Karma told by Sushruta in Kumara Gara, Sutika Gara, Vranita Upasani Adhyaya in Vranita Gara, where it tells regarding the use of everything. So this is told in the 5th chapter Agroparanya Adhyaya in the form of Dhupana Karma, right? Drugs, what are the drugs? Tatra Gugulu Agaru Sarjarasa Gaur Sarshapa Nimba Patra Churner Ravana Mishkrita Ajya Sheshana. The explanation is very beautiful. Everything should be taken to be burnt and to be get rid of the organisms in and around us. We should do this. Okay. Coming to next, Balagraha Chikisa, Sarshapa, we use it for Snana, Lepana, etc. Everything in a Balagraha. We have told it, Sushruta has told it. 9 as well as 12. Stri Balagraha, Pum Balagraha, Purusha Balagraha. Everywhere, use of some medicines which are Krimihara, Vishagna, they should be used in the Balagraha Chikisa. Sarshapa, very commonly used, right? Next, coming to drying of raw drugs. Any drugs preparation churna form, we dry the drugs, then we make it churna form to get rid of the. Now coming to Ayurvedic review in regarding surgical concept in our text. First is Payana Vidhi, Shastra Payana Vidhi, where we have a Nirjantukarana, the iron ore materials which are taken directly from the stainless steel, they are done the what we do Payana Vidhi, right? We heat into a red hot and we dip in a Drava Dravya, where in which the qualities of the Drava Dravya is being taken by the instrument. So here both activity, Nirjantu Karana is going to occur along with the tempering of an instrument, both. Next is Mantra Patana in the Raksha Vidhana, Raksha Karma, as well as the Sarpadamsha Chikisa. So some sort of positive vibrations are created with a unique wavelength which can cause a physical method of activity of sterilization. And the next is the last one. There are many antimicrobial agents, procedures told in the form of Shodhana Gana, Rakshogna, etc. in Sutika Gara. We can go with that, and research need activities to be needed in this regard. So with this, we have seen the summary regarding the antimicrobial agents, sterilization, disinfection, antibiotics. I have not touched. The reason is it is a very vast topic, so we can have it on another class. And Ayurvedic perspective of Nirjantu Karana. So concluding the topic, sterilization, disinfection are the important and integral part of medical field. Chemicals and disinfectants to be used, handled with care and caution. And in regard with Ayurveda, we need still a research activity in this regard to explore our drugs as a instead of betadine, we should use some other drugs of Ayurvedic, what I feel in future coming days, as a standard drug for cleansing. With this, these are the references. And last but not the least, the take-off message of this today's presentation is civilization is sterilization, what I feel. And it is not my view, it is Aldous Huxley, who is a great author from an English, and he is a socialist as well as a writer. So he writes as civilization, being civilized itself is a sterilization, right? Taking a proper bath, exposing our body to a sunlight, having a hygienic condition itself is meant as a sterilization according to him. So very beautiful quote, and I feel it's a very right time to say this. Civilization is sterilization. Be civilized. Let our Ayurvedic surgery flourish. But keep in mind, we should always practice with all the aseptic techniques. Never do vague surgery. Never do vague without giving without wiping with a spirit. Don't give pricks. Do not do septic surgeries. We should follow all the septic precautions, techniques, and let us do surgery and flourish in future. Thank you. With this, I thank all the Sushrutas for patient listening. Thank you, one and all. And I take this opportunity to thank Dr. Asma, who is my wonderful junior as well as a friend, and Dr. Chandrakant Budni, for both of them, and the head of the department, Dr. Sidling Swami Murthy sir, for giving me an opportunity to share my view in this regard. So thank you one and all. If any doubts are there, you can message me so that I can reply.
So as for now, so am I audible?
Okay,
am I audible?
I was a bit fast, but I could not communicate. I'm sorry for that. Hopefully, at least 5 to 10% information I think I have spread here today. कुछ किसी को कुछ डाउट्स है तो पूछ सकते हैं, या तो मैसेज कर सकते हैं थ्रू डॉक्टर आसमा, दे कैन मैसेज मी. And I even thank for the doctor who is there in front of me, who has introduced me. Thank you for the introduction. Okay. Okay, Asma.
Am I audible?
Okay. Thank you. Thank you. Any doubts, you can message me so that I can reply to the doubt.
Am I audible to you? So am I audible?
Okay, no problem. I am unable to listen. You can just message me the doubts if they are present. If not, we can conclude the topic. Okay, if we
Audible, sir?
Shall we conclude? Okay, students, please raise your hands if you have understood anything out of this presentation. Students, you can raise your hand, you can express your that if you have attended attentively and you have understood anything. If not, you can do this also, you can wave your hands and say this also. Okay, okay, at least you have understood. Thank you, thank you. I thank once again the SVM College, Ilkal, for giving me an opportunity and sharing my view. Thank you, thank you all.
Sir, am I audible?
Thank you. Can I disconnect? Can I?
Sir, am I audible?
Okay, thank you.
Okay, sir. Thank you. Thank you, sir.